Thank you very much to Chanel and to Benoit for that introduction. One of the things that I think is important for us to note is that the human resources crisis that we talk about within supply chain is part of a global human resources for health crisis. And we're very grateful that Giorgio Cometto is here with us from WHO representing GWA, and will speak to us on the global context of the health workforce for universal health coverage, a new discourse. Thank you.
Thank you, Andrew, and good morning, everyone. It's a real pleasure to be here, as well as an opportunity for us. I have been asked to say a few words to help set the context for your discussion in relation to the health workforce dimension in particular. In the last few years, there has been increasing attention to human resources for health issues, in particular in relation to the universal health coverage objective and the realization that this objective cannot be attained in the absence of adequate health workforce, but also more recently in relation to the global health security discussion, in particular in relation to the Ebola outbreak in West Africa. More and more articles and analysis are published both in the peer-reviewed as well as in the mainstream literature that speak to these issues. In particular, last year at the third Global Forum on Human Resources for Health, we undertook an analysis of the health workforce implications of universal health coverage. And what we found basically was that the majority of countries throughout the world do face health workforce challenges. There are varying levels of shortages depicted here in this world map in different colors. But even in the countries that don't face an absolute shortage per se, primarily high-income countries in Western Europe and North America and elsewhere, there are substantial workforce challenges, be they related to geographical maldistribution, to spiraling costs, to uneven quality of care. So on the one hand, this speaks to a global problem, but on the other hand, that creates the opportunity of framing this as something that requires a global agenda. We're all in the same boat together on this. When conducting such analysis, typically the attention is grabbed by the headlines, in particular if we can put a big round number on top. And in the case of this analysis that we conducted last year, through some modeling, we estimated that currently, or actually last year, there was a shortage of approximately 7.2 million health workers, and this on current trends is set to increase to 12.9 million in the coming decades. At the same time, I think it would be very simplistic to reduce a discourse on the health workforce to numbers. Numbers tell us if the workforce is available. If you want to make it very concrete through an example, do you have a midwife in your community? But availability per se does not guarantee coverage. In order to progress on the path of coverage, one has to consider other dimensions beyond availability. So in the first place, accessibility. Is the midwife available as and where needed? Is the population able to access her services without barriers of financial or geographical nature? And also, as importantly, are the services that she provides acceptable to the population? Is the care that is being rendered respectful, in other words? Finally, the quality dimension is critical because it's only when we progress all the way to quality workforce that we can actually talk about effective coverage. And so one has to ask the question of whether the midwife who is available as and when needed, with no barriers to access, providing respectful care, does she have the required competencies? Is she enabled to deliver effective care through the required support actions that the health system has to provide? Now, this framework is generic. It doesn't apply, it's not specific to the supply chain workforce, but I think it's useful to conceptualize also how one can think of the supply chain workforce. We know there are challenges that affect the health workforce in general, but I think it's important to also reflect in the context of this conference on some that perhaps are a bit more specific to the health supply chain workforce. Here I have grouped them according to 3 categories. In terms of the evidence, I think there is, in the health workforce community, in general, we complain that we have really bad data, real poor data. I think if anything, the supply chain workforce data are even poorer. I hope you don't take offense in this, but it's something that I realized doing a quick scan before this conference to prepare for this presentation. I think you have extremely limited data on availability, on distribution, on curricula, competency frameworks, remuneration, regulation, and support systems. And this dearth of evidence seems particularly acute with regards to low and middle income countries. Evidence is the basis for sound planning. But when we come to national health workforce strategies or the health workforce components of national health strategies and plan, we see that the health supply chain workforce is not always reflected and embedded in the broader workforce planning and budgeting. Reviewing national workforce plans, sometimes we do see pharmacists, pharmacy assistants, but it's a very rare experience to see a mention of administrators, logistics managers, warehouse and transport personnel, all cadres that you know better than me are critical to the effective running of a supply chain system. And coming to implementation, the challenges are numerous, of course, but here I want to highlight perhaps a couple that relate to leadership and talent. When discussing with a colleague of mine from WHO, Lisa Hedman, I don't know if she's in the audience yet, but she pointed to me something that is a pretty simple concept, but yet I found it an eye-opener in a way. When we think about the leadership of the supply chain systems, the managers of the central regional medical stores, sometimes their accountability is on implementing a budget. It's not on guaranteeing access to the population to quality and effective medicines. So in a way, I think action on leadership is required to ensure that we align the objectives of these institutions with broader public health objectives. And I think this is something that is sometimes taken for granted. It is not given due attention, but it's a critical dimension of working really towards effective leadership inspired by the same goals that the public health system at large has. And related to that, the governance environment has to be strengthened in order to guarantee an enabling environment and attract talent. Many of the actions required to strengthen the supply chain workforce are similar or can be implemented in the context of broader health workforce strengthening actions. So if we map them against a standard health workforce framework that looks at the education sector, identifying trainees, training them, and then facilitating their transition into the health labor market, and then all the labor market dynamics, including the factors that affect health workforce retention and performance. We see that there are policy levers at every stage of this process, policies that relate to the production, policies that can address inflows and outflows of health workers, and those that address maldistribution and optimize performance. Now, many of the actions that you would probably consider are similar also for the supply chain workforce, such as, for example, ensuring on the education side that the competencies that are included in the curricula are adequate and that are adapted both in terms of the contents of training and the modalities of training to new and emerging realities. establishing rural pipelines for health worker training, which is proven to facilitate later on retention in rural areas. In terms of the labor market dynamics, for example, improving public sector conditions so as to avoid or is to be able to counter competition from the private sector and retain talent in the public sector. These are ideas and concepts that apply quite equally for the health workforce in general, as well as the supply chain workforce in particular. But I think there are also some aspects that probably are more specific to the supply chain workforce. In the first place, the extent of shortage for some cadres is so great that it needs to be tackled specifically through specific scale-up efforts, in particular for certain cadres. The idea of mainstreaming relevant competencies in the pre-service education of health personnel. This is something that again is quite specific, because very often the clinical staff lack really a basic understanding of what the supply chain functions entail, and having such competence could enable them to be more effective also in relating to the supply chain workforce. But this should probably proceed in parallel, and here again I know I'm preaching to the converted, but this should proceed in parallel with significant efforts to professionalize the supply chain workforce. And in particular, there seems to be an acute need for building capacity on certain functions, from forecasting to procurement, quality assurance, stock management. While the need to invest is perhaps not an exclusive feature of the supply chain workforce, I think you have a unique argument to make in that in terms of size, the supply chain workforce is relatively small compared to the overall health workforce size. And at the same, so if we consider this as one element, and as another element, that the amount of wastage through irrational, inappropriate, inadequate procurement, distribution, and utilization of medicines and other health technologies is of such a magnitude that you could probably make an argument, and I think it would be interesting to also learn if there is evidence from this conference, that the savings that you could realize might offset the investment needs that could potentially be made through professionalization of the supply chain workforce. It's a time of opportunity. Now more than ever before, there is political attention to health workforce issues. And here I want to bring to your attention a couple of recent developments from the last year. At the Third Global Forum, which took place almost a year ago in Brazil, there was a strong demand from the governments in attendance to better recognize the needs that the universal health coverage objective implies in relation to human resources for health issues. The call from the Third Global Forum was then brought to the World Health Assembly in May this year, and not only the World Health Assembly endorsed the call to action that emerged from the Third Global Forum, but they also requested the Director General of WHO to develop a global strategy on human resources for health. The process to develop this strategy is ongoing at the moment. We're facilitating a process that builds on evidence and best practices and tries to harness information and evidence from different disciplines, different sectors, different constituencies. We want to make sure that we make it relevant to the needs of all countries, with the understanding that health workforce challenges affect not just lower and middle income countries, but really countries at all stages of socioeconomic development, with the objective ultimately of having an impactful strategy accelerating health workforce actions at all levels, and that would be one of the elements considered as part of the discussion on the post-2015 health development priorities. So just a couple of pointers on the process. This started in late 2013 following the third Global Forum on Human Resources for Health. We are now in the middle of a public consultation process to which I would invite the organizers of this conference to feed into. We are having a public hearing on evidence papers that have been developed and that will form the basis for the development of the global strategy. This process will unfold until the end of 2014, and then next year, the board of the Global Health Workforce Alliance will consider the draft global strategy and will submit recommendations to WHO on issues to consider as part of the global strategy development. At that point, the process will continue through the routine WHO modalities, and so here there will still be an opportunity for WHO member states to feed into the consultation process and actually develop and own themselves the strategy. This will take place in 2015 through the WHO regional committees in the period from August to September, and then eventually after taking into account also the ultimate decisions of the UN General Assembly on the post-2015 development framework, this will be then refined and submitted for consideration by the WHO Executive Board and the World Health Assembly in January and May 2016, respectively. To conclude, I want to share with you a quote from the Assistant Director General of WHO for Health Systems and Innovation, and I will leave a few seconds to actually read it. I think one can say probably the same things about the supply chain workforce, and I think it's critical that in responding to today's needs, we also anticipate and plan tomorrow's needs. We must remember the future. You will find on our website more information, the links to the sources that I used, as well as the details of how you can feed into the consultation process on the global HRH strategy. Thank you for your attention.